Hi, I'm Shel Holtz. I'm principal of Holtz Communication and Technology. I am an organizational communications consultant. I'm also a member of the Mayo Clinic Center for Social Media External Advisory Board. I was here today with a couple of folks that I worked with in an internal communications audit at Johns Hopkins Medicine in Baltimore, talking about how to reach employees who don't have access to computers. Since the innovation of the intranet, a lot of organizations have been abandoning other forms, other channels of communication, notably print, because of the time involved and the expense involved in producing print. They've also been scaling back on face-to-face communication and relying not just on the intranet but also email. But for a lot of employees, that's not a practical solution. They don't have access to it at work. There may be collective bargaining agreements that precludes their taking advantage of it remotely from home. And it's important to reach these people. The front line in particular can be the most important audience with which you have to communicate, and yet this has become the group that resides on the wrong side of the digital divide in the workplace. And we talked about the various channels that are used at Johns Hopkins, and if you looked at it very superficially, what you would have taken away is that there are a lot of tactics available to organizations. In addition to print, there are bulletin boards, and by this I don't mean the digital bulletin boards, but the old-fashioned analog bulletin boards. You push pins into paper and hang them. There's town hall meetings, there's digital signage, there's a variety of different tools available to us, in addition to mobile, as employees increasingly are bringing their own devices to work. But all of this has to be driven by strategy. Employees don't self-identify around issues and interests that are important to the leaders of the organization, who are generally the ones who are driving the messages that communicators are delivering. Employees identify around their work teams, the peers that they work with every day, project teams that they may be involved with that are pulling people from other departments, but they're working very often in a limited time frame on specific goals, and their manager relationship, their frontline supervisor. This is where they self-identify, and this leads a lot of executives to think that employees don't really care about the issues and the interests that they care about. In fact, the employees care very deeply about this, but they require context, how it relates to the jobs that they do, how it relates to the people they work with, the project teams they're on, and their relationship with their boss. So it's incumbent upon communications to start to use the channels in a very strategic way based on research so that you know you're moving the needle in order to reach these employees with those messages so that they have the context and can align their work with the issues that are important to leadership, and ultimately what you'll get out of that is a higher level of actively engaged employees. The tactics are what most communicators spend their days working on. We crank out articles and content for the intranet. If you have a workforce where mobile is enabled, or you're allowing them to bring your own device, BYOD is a movement, not a corporate initiative. Employees are going to do it whether there's a policy or not. But the ability to make content available to them that is meaningful to them where they work. So text messaging, for example, a lot of organizations are using this so that employees can subscribe to receive all the text messages that have to do with their facility and their area of specialization. And this way they get to ignore all of the corporate messages that they don't care about because they don't work at corporate. This doesn't mean, of course, that you can't convey those messages to them, but you do it through other channels. Johns Hopkins, for example, is using window clings. They have a lot of window space in some of their newer facilities, and on a monthly basis they're replacing these window clings that are very visual, very compelling, very striking, and deliver a message or tell a story simply as somebody's walking by. They don't have to stop and read it, but they're using one of what we're now referring to as a previously unusable moment to get a message just as they're passing by. On mobile devices, you look at the rise of popularity of Instagram and Pinterest and Vine and Tumblr. You look at the fact that half of what you see in your newsfeed on Facebook is images. You look at the data that shows that you have just massively greater interaction and engagement around images than you do around text. And you see an opportunity to reach employees where it only takes a couple of seconds to glean information from an image or a 6-second video, where they wouldn't have the time to read an 800-word story or watch a 3-minute video. So these are some of the tactics. Even the old-fashioned bulletin boards where employees walk by and right now they see the OSHA and employment law, HR law notices. There are huge opportunities to capture the attention of employees who are walking by. Digital signage is getting increasingly popular in internal communications. It's actually a trend. We're not talking about the flat panels where you're running a PowerPoint presentation, something people have been doing for decades now, but real true digital signage that is interactive through touch and through motion, and you can target information to the displays that are on different floors based on who's working on that floor. Just lots of tactics that are available, but again, I think you have to be looking at the needle that you want to move and which tactics are going to be effective with your employees. And the only way you're going to find that out is to ask them. You really need to do your research with employees so that you can figure out how effectively you're moving the needle, and then make mid-course adjustments based on those regular pulse polls and other research methods you're employing.